Good evening. I'm going to talk about addiction. Everywhere we should have heard about addiction, but the scientific truth behind the substance abuse. In your mind, you can be okay, you can just do one, but one is too many and 1,000 is never enough. In the beginning, it feels really good. Your pain get high, and toward the end, you are feeling really stupid because you are paying not to be sick. Don't believe the hype. Don't believe your eyes. In the end, it is not worth it. A visual journey through addiction. Why do people start taking opioid and why can't they stop? Through interviews with users and experts. A visual representation how the brain hijacks the drug hijack your brain. The opioid is endemic. Epidemic. Some part of the world there will be like it will come and it will spoil the whole country, like America and South Africa, and it is devastating. In America, under 55, it killed more people than HIV at the peak of the disease, and its death toll exceeds those of the wars in Vietnam. Why do so many people start using these drugs? Why don't they stop? Some people are more susceptible to addiction than others, but nobody is immune. For many, opioids like heroin entice by bestowing an immediate sense of tranquility, only to trap the user in a vicious cycle that essentially rewires the brain. Some people are more susceptible to addiction than the others, but nobody is immune. Getting hooked is nobody's plan. Some turn to heroin because prescription painkillers are tough to get. Fentanyl, which is 50 times more potent than heroin, has snaked its way into other drugs like cocaine, Xanax, and MDMA, widening the epidemic. To understand what goes through the minds and bodies of opioid users, the researchers spend months interviewing the users, experts, family members, addiction experts, and using their insights, we created a visual representation of how a strong lure of these powerful drugs can hijack the brain. What is addiction? See, it has got a mini stage. Stage 1 is gateway. You can easily understand. Gateway is where the people enter into the addiction. That is the first stage. A user used to say, like, whenever they are in the gateway, no, whenever in the first stage, no, they used to say the word like it's been like hugged by Jesus. One of the users told the same way, it's like being hugged by Jesus. Another man told that I remember feeling like I was exhaling from holding my breath for my whole life. Just intense relief from pain, suffering. You naturally produce endorphins. Endorphins, it's a body's own version of opioids, natural opioids, which act in reward circuits of the brain to make you feel good. After you work out, or you hug somebody, a friend, or a lover, any relationship, or eat your favorite food, a drug like heroin creates a tidal wave in reward circuit of the brain. To the outsider, it looks as though you had passed out, but on inside you feel like a master of the universe, like you are being hugged by a Jesus. As the one user said, there is a peace in your skin and not a single feeling of pain. You may remember the exact moment for years to come, where you were, what you saw, what you heard. You may chase this feeling for years. As a high wears off, the brain regains its balance, but not for everyone. Just the opioid trap for many people. In the beginning, no serious ill effects are apparent, but the brain rewires little by little with each use. Second stage, this is a stage of intolerance. It was like a high, put on binders to everything and made me not care about anything in the world other than the heroin. The user used to say, it was like a high, put on the blinders to everything and made me not care about anything in the world other than opioids. Another man told like this, any time you start to feel like you are getting antsy or anxious or little bit of stressed out, your body says exactly how to get out of this, and it's telling you to take a little more of that heroin. So you are chasing a siren of the first high to take more. You are chasing that siren of the first high by taking more, but even 1,000 of doses will never bring back that first high. It was the experience first time when he gets no, that is the master of the universe, he can do anything in life. That kind of first high, he never get it. But intolerance, he tries to get it again by using the drug. The brain balances its own endorphins like a thermostat. So you know about thermostat, how it works. When it is very hot, it will stop by getting hot. If it is a heater, if it is a AC, it will maintain it cooling effect. Like that, our brain endorphin balances. It's like a thermostat. When an external source keeps flooding the brain, it's thrown that system off. So externally you are putting some more endorphin, that is heroin, into the body to overflow. So the brain system, that thermostat is affected and get lost from that system. So there is no balance at all in the brain. Like other drugs, opioids produce a surge of dopamine, another hormone called a dopamine. It will be a surge, a chemical, it's a chemical messenger that tells the brain that taking this drug is good, and you will repeat it. The brain, in response to opioids and the surge in dopamine they cause, can rewire the circuits in brain. So it will start to rewire the brain circuits. The brain is response to the chemical changes make life difficult without the drug. Yes, stress, irritability, creeping. So you take more opioids to cope these symptoms. Soon nothing else in life provides any satisfaction. The pleasure and reward cycles flip. You get less pleasure from the drug, but want it more. The more you seek and take the drug, the more the brain adapts to the drug and demands more. So it's a horrible thing. And stage 3, that is the worst, withdrawal. Stage 3. The user explained like this: it's like a demon crawling out of you. You had rather just die and done with it than go through that. Another abuser says, everything hurts. It hurts in comb your hair. It hurts you save. You have no energy. You feel weak. You feel a sense of desperation. You have constant impending doom and anxiety because you realize that with one pack of dope you can change how you feel within a matter of 10 seconds. The final trap of addiction is laid, which you muster the courage to stop. You may not even realize that you are physically dependent until you experience a withdrawal for the first time. There must be a crippling pain, vomiting, insomnia, spasms, hot and cold flashes, goosebumps, congestion and tears. All this on the top of debilitating anxiety and depression. You might feel like you are having the worst flu of your life, or like a demon it's crawling out of your skin. This misery would last for weeks. Dying from withdrawal is uncommon, but it does not feel that way at the time. These harsh symptoms can make quitting seem impossible. Another stage is stage 4, that is the addiction. It's like a time bomb. You have got 24 hours to get heroin, or you are going to really sick. You wake up and your whole life is just based around it. You used to live and live to use. It felt like all my relationships were very surface level, and really I was holding people hostage. No one was really my friend. I just wanted to take things right from them. This was the another user was telling. Another user, this is the stage like I would be an old lady on Mac and would think I could grab her pocketbook for cash. That was probably the beginning of the end. The brain screams for more. Scoring the next fix feels like a race against the clock of withdrawal. You may feel like only a fix can save you. It makes no sense, but this compulsion takes over all logic, judgment, self-interest. You may do things you never thought you could. Sell your body, abandon your child, steal from your mother. You might lose your job, lose your home, lose your loved ones. In this sad stage, families are torn apart. Sharing needles can make things even worse and bring about hepatitis and HIV. You are now addicted to opioids and you no longer take the drug to get high, but to escape feeling low. The brain had adopted a new form of compulsion that can reassert itself even after years of sobriety. Stage 5. This is where the treatment comes in. My brain felt like the user at the end, when he comes to the treatment, he used to say like this: my brain felt like it was rewired, my body, mind and soul. It's a day at a time. I can do anything for a day. Once I bought into that, I made some other friends. Things started to change for me. Another user telling the same exact words like this: there was a push factor, which was a misery and self-hatred and the depression and the cops. And then there was a pull factor, which was this amazing hope from this community of people who I knew understand me in a way nobody else in the world could. That is where the support programs come in. You hit rock bottom, perhaps after a run-in with the law. You fear withdrawal. You dread confronting with you why you have started, why you have become. Willpower alone may not be enough, and quitting cold turkey could increase the risk of overdose. You may not have access to treatment. You may not be able to afford it. Or you may hear that quitting is impossible and that taking medication help is simply swapping treatment centers that promote abstinence or at the odds with the medical standards care. Long-term use of medications like buprenorphine, methadone, naloxone, but only about 25% of the outpatient centers provide them. These medications soften the cravings without euphoria. They help to reset the brain thermostat so it can stop thinking about opioids 24/7 and hard work recovery can begin. Every person is different, and underlying issues such as mental health problems can affect treatment plan, but therapy and community help the increases the chances you stick with it. And the stage 6, that is the recovery phase. Sorry, it's a relapse phase. This is the relapses. They used to say it's a part of the treatment. A lot of times in our addiction, things are getting better. You see a light at the end of the tunnel, and it ends up beginning freight train coming at you. That the people used to say in this relapse, the old impulse comes back. That old habituated response, which is, this is hard, you are going to fail, and don't even try to get well. You are just going to end up back in. So just go get high right now. The brain used to say sometimes these things to them. Relapse is a normal part of the recovery, but it also brings dangers. After abstaining from a drug, your tolerance decreases, even if the cravings remain intense. The same amount of drug that you took before can result in overdose, especially if it is laced with fentanyl or mixed with benzodiazepine and alcohol. In an overdose, your body is unable to handle the drug and your breathing slows or stops. 77% of the opioid overdose deaths occur inside the medical settings, and more than half of occur at home. Once revived, you may feel anger, shame, or face stigma and judgment. This year, the Surgeon General advised Americans carry naloxone, a life-saving medication, to resuscitate the victims. They used to carry the naloxone. Once, for families of those who are addicted, life has become a roller coaster ride. They relapse, they recover. So they used to say on and off. For the family, it's a very, very, very roller coaster ride. And then comes a final stage, that is recovery. Stage 7. Colors get brighter and smells are more intense, and emotions just are much more powerful because opioids numb them. So they used to say the colors are brighter now. They used to show my emotions are, I'm able to feel a powerful man. And one user used to say what exactly is, I did not have interests or hobbies or anything. So finding what I really liked doing was really beneficial to me. Because if you don't have a fun, then you are not going to stay sober. From now on, I have to guard my sobriety with my life because my life depends on it. Recovery is complicated and takes time, but it is not impossible. Experts say treatment could require 6 months to 20 years. One expert say that average person could relapse 4 or 5 times over 8 years to achieve a single year of sobriety. Some people may have remain on medications indefinitely. For others, a doctor may taper them off. But doctors don't know when the brain has reset itself and is no longer at high risk for substance use. Only 1 in 5 people who need treatment for drug use actually receives care, and only about half of those are given medications. Experts say those given medications rarely receive them for long enough. Like a child, you also need to learn a new behavior and rebuild your life. It is a journey to accept, control, heal the feelings that lead to addiction. So this is what the addictions, and it's a disease. You have to get the treatment. So we are the people who can come to redemptive recovery care and get the treatment. www.redemptiverecoverycare.org. You can access the website, or you can call by phone 790-496-6416. We will answer your queries. You can mail me also, achamail@gmail.com.